Well, after almost a decade of discussion, the UK's first legal consumption room for drug addicts opened this morning in the East End of Glasgow. The Thistle allows users to inject illegally bought heroin or cocaine under medical supervision. It is hoped the centre will reduce the number of overdoses and other harms related to drug taking, as Scotland has the highest death toll from drugs in the UK. Let's speak now then to Allan Casey, who is Glasgow City Council's Addiction Services convener. Allan, I appreciate you coming into the studio today because after years of talking, it's finally happened. The Thistle's opened its doors. I'm going to guess it's been a busy day for you. How's it all gone?
It's been very busy and it's been a long journey. Obviously, you said there over 10 years for some folk to get to this stage. We're very pleased about how today has went. I think it's fair to say this morning was a bit quieter than maybe we expected, but as the day has went on, we've had double figures now over the threshold, which is really, really good news. And some people have come back more than once, so they're clearly happy with the service that they've got and clearly comfortable with coming and using the service. So really, really positive news and positive feedback actually. And some of those folk that have come through the door as well are people that we've not had any engagement with whatsoever before. So that shows that we've built that trust with them to come over the threshold and receive the service that they're going to be getting at the Thistle. There's
obviously been a lot of media attention on this. There'll be people that don't agree with this. It has been a source of debate, hasn't it, for the last decade almost. What difference do you hope this will make in trying to tackle those drug deaths?
I mean, first and foremost, what we need to do is save lives. That's clearly the main aim and ambition of the Thistle service, and that's exactly what we hope to provide there. But there's wider benefits as well. Obviously, the local community, as you say, are sceptical sometimes about this type of service, but there's a lot of support for it locally as well. But we need to demonstrate to them that there's benefits for the wider community. But obviously, with that in the back of our minds, that the main aim of ambition there is to get those who are furthest away from services to come through the threshold and get the treatment that they really need. So, as I say, it's a massive leap forward in how we deliver our services. It's just one small part of a wider picture. We know this is not a silver bullet. It's not going to change the figures and all of that overnight, but it's a massive leap forward in how we deliver those services to folk.
What do you think could be next, Allan? Could we see another centre like this in another town or city, for example? Do you think we could see this service offered elsewhere in Scotland?
Yep. That's my hope, in the sense that I know that it's needed. So clearly what we need to do is we need to demonstrate that it works within the confines of the UK, but hopefully we can demonstrate that this does make a difference and can be expanded across either one in another part of Glasgow or indeed across Scotland as well, because we know it does make a difference and we know that the evidence shows that we can really, really turn the tide on this.
Allan Casey, I really appreciate your time. Thanks very much for joining us on the programme.